Hey, good afternoon. Dr. Alan Christensen here with you. Welcome to Office Hours Live. So yeah, good to connect today. We're at Monday afternoon, normal time here, and just had a holiday week. So good to be back and get some momentum going again. I'm with you guys on Instagram, on Facebook, and on YouTube Live. So whichever platform, it's all good. Let me know where you're from and any top health questions. I'm seeing a lot of folks jump on right now, and that's always cool. Yeah, I'm just watching and we're getting going properly. Sometimes the tech is weird and not all connect well, but it looks like we're good today. So, okay. So Office Hours Live. Yeah, welcome. If you've been here before, you kind of know the drill. If you're new here, this is where I've always got a few questions that were sent in before, and I'll cover those in some good detail. And then we'll grab a few of yours live. I'm seeing Lexi with us from Henderson. Hey, Lexi, welcome. I lived in Kingman, Arizona for a little while, and Dad had a business in Henderson. We actually commuted for a while. It was like 90 minutes one way. But yeah, I've been in Henderson quite a bit and always in Vegas for medical conferences. And Fleur is with us. I've been communicating with her a bit. She's a nutritionist in the UK who's helping people with thyroid disease. Good to see you. We got Karen from Napa, Frankie's in Waco. They got some sun for a change. Many others coming on here as well. I'm looking at the different platforms here. Katie's just starting to read the Metabolism Reset Diet, hoping to reverse non-alcoholic fatty liver disease. Katie, welcome. Yeah, it was almost the liver reset diet. It was so close to the title because that's a big focus of it for sure. Joanne is here. What happened to the facial hair? I thought maybe you're doing No Shave November. Lisa's here from New Mexico. Joanne, I actually had permission from Kieran to let it keep going a little bit longer. I wasn't a fan myself. It was kind of itchy and irritated, and I don't know, it was kind of annoying me. It just felt strange, and yeah, so I shaved it off early. There was one time many years ago in which I had grown it for a little bit, and Karen wanted it gone. She was fussing about it, so I agreed to compromise with her, and I shaved half of it off. I went around for a day like that, and most people didn't even notice. That was kind of a funny thing. Christine's here from Michigan. So yeah, good to see you guys. Welcome aboard. I've got a couple of good questions sent in, and I'll cover a few of those. And if you've got any live, this is office hours. This is where we can cover things in detail more than you would find by just Googling a topic. So don't be afraid of putting details in your question. The more, the better, and we'll get a good conversation going. I love to get follow-up questions. I'd love to get questions that relate to others because there's so much depth, there's so much nuance, and there's so much complexity to things. And we rarely hear that. We often hear like the really basic thing that applies kind of to a lot of people, but not really to anyone. But this is where we can go past that. This is where we can talk about things in ways that are much more meaningful. So yeah, I'd love to hear what's top of mind for you all. And let me lead with a few of these questions that were sent in advance. We'll get going with those. And here's the first one from Fleur, who I saw on earlier. So asking about if it's normal to see a slight rise in thyroglobulin antibodies following a low iodine diet. I know there are tons of factors affecting antibodies that I'd ask. Thank you. Yeah, happy to help with that, Fleur. So TG, so thyroglobulin. Now, there's thyroglobulin and there's thyroglobulin antibodies. They're different tests. You're talking about the antibodies, though. The short answer is they can go up a bit, and by a bit, rarely more than a 75% increase. Now, why would that happen on a lower iodine diet? Well, iodine itself attaches to thyroglobulin, and that's how the body makes thyroid hormones. Now, when there's too much iodine, it goes on the parts of thyroglobulin where it doesn't belong. There's 13 like seats on the bus, 13 designated spots. They're called tyrosol residues, but iodine can stick on that molecule at a lot of other places as well. When the body is clearing the extra, there is a faster turnover of thyroglobulin. And as new thyroglobulin is being made, the antibodies can go up temporarily. Now, it shouldn't be much and it shouldn't be lasting. Having said that, another thing is that thyroglobulin antibodies can also fluctuate. So sometimes they bump up and down for no clear reason. So always look at a couple of readings to make sense out of a big trend. So yeah, great question. Um, and I'm seeing a lot of people that are just now coming on, a lot of new names I'm seeing here on Instagram. So welcome, love to hear where you're from. If you've got top questions about your hormones, your metabolism, your thyroid, bring them on and I'll do my best. If I've got a good answer, I'll share that. And I may well have some follow-up questions. So hang around and see what you got. All right. Some good live ones coming in already. Yeah, and if I give an answer and if there's some things to clarify further, please do put that. I'd love it to be a detailed conversation. Martha's asking, can a woman of 64 still be taking bioidentical hormones? Martha, yes, there's a thing called the estrogen window. There's a window of time in which if a woman starts hormones, in most cases, the benefits outweigh the drawbacks. And that window of time is right around the first 5 or 10 years of menopause. So typically mid 50s to early 60s. Now, a woman starting in the mid 60s, there are more situations in which that can be contraindicated. There's more times in which that can be counterproductive. But as far as being on them, there are some valid reasons to be on in the 60s. And that can include, of course, like hot flashes and night sweats and also just sleep disturbances. But in many cases, those things can also do better from basic lifestyle changes. We see data showing that usage of caffeine, usage of alcohol, how much plant foods are in the diet. These are things that can have a big impact upon hot flashes as well. So they can be used. They may not always be necessary. They may not always be needed for women who are those ages, even for hot flashes. So yeah, it's more a matter of when they're started than at what age they're used. So I'm seeing the follow-up comment, or actually Frankie's giving a related comment. I am 68, still feel much better taking when not taking them. So yeah, Frankie, the funny thing is that it's when you start. If you start in the earliest years, then there's probably more safe reasons to persist. But starting later on, then there are situations which they're not always indicated. That's the big difference. Yeah, let me get another one up here of these that were sent in advance. So here was a good one, and this came in recently. Do you recommend red light therapy for healing thyroid nodules / Hashimoto? Thanks, Dr. C. Yeah, this is a good one. Red light therapy. There's a study that came out from South America, and this came out about, I think it was a decade and a half ago. And the study suggested really dramatic benefits for reversing thyroid disease, healing thyroid tissue by using red light laser therapy. And for a while, it sounded like this was just going to be the thing, that this would be like the way to reverse the disease and solve nearly all problems. And a lot of folks were looking at it and waiting to see how it would play out. But it failed the whole process of replication. And what that means is when others tried to repeat the study, they didn't get the same results. So yeah, it seemed exciting for a while, and you'll still hear it talked about a bit, but there were some follow-up studies, and quite simply, it wasn't effective or wasn't helpful. And I'm not really making this as a blanket statement about red light therapy or lasers across the board by any means. I don't have a lot of strong opinions either way. But as far as thyroid health goes, it just didn't seem to pan out. So yeah, it looked really encouraging based upon one smaller trial, but then follow-up studies showed just no efficacy. Now, there never was data suggesting that it was harmful or bad or that there were drawbacks to it, but it just failed replication. So yeah, that's kind of gone by the wayside as a common idea. Okay, we had a little glitch and paused on Instagram, but now we're going again there. So welcome if you're on Instagram. You're here with Office Hours Live, and love to hear any of your questions about thyroid, hormones, metabolism, body weight. Those are the big topics. So yeah, welcome. Okay, so for follow-up questions, I'm looking at, there's some questions about HRT in various ages, and Frankie's just saying early menopause began at 42, then yeah, there's many situations in which they can be safely used. Now, many women are not candidates, and some prefer not to take hormone replacement, and that's fine too. There's more and more data showing that simple things like dietary changes can make a big difference for some of the main menopausal symptoms. And actually, I'm excited. The next book I have coming out, the release date now is going to be June 8th. So June 8th, 2023, that's our official pub date. Truth be told, I just got a big long list of more edits that just showed up in my inbox like 10 minutes ago. I was sure I was done. But when it's done, I'm going to be proud of it. But this will talk about ways to use foods to reverse hormone symptoms. And that's going to include hot flashes and night sweats. And there's great data about this. Common everyday foods, good recipes can make a big difference. And Bubba's asking me a really simple question. And I'm going to give Bubba a proper answer because we went back and forth on this title so much, and I want to get it right. Let's see here. Okay, so the new one, which is, the Hormone Healing Cookbook. Yep. There's a lot of discussion points about these things. The Hormone Healing Cookbook, and Bubba, I'll even drop the link. We've got it up now for pre-order there on Amazon. And as a cookbook, it's going to be a beautiful glossy thing and lots of colors, but it's going to be cool. So, yes. Hey, Jennifer, thank you for that. This is a question that I had queued up. This was one that was sent in advance, and I was going to get it anyway. So thank you for getting it up again, Jennifer. We'll totally cover this. Do you see any glimmer of hope that in the future, food producers will stop using iodine in dairy, egg, and commercial baked food production? So I wanted to grab this one because for dairy foods, the answer is yes. There's been a lot of talk. So with iodine in dairy, there's three big sources of intake, one of which is iodine added to fortify cattle feed. The other one is cows fed fish meal as a cheap protein source. It's got a lot of iodine in it. And the third one, which is probably the biggest, is that iodine is often used as a teat sanitizer. So when cows are milked, they've got these suction cups that fit on their teats, on their nipples, and these things are they're pulsating for a period of usually an hour or so. And they get irritated, they can get raw, and they can get mastitis, they can get infected. So it's very common to apply a sanitizer to lower the risk of there being a bacterial infection. And iodine is the most common one used. Now, there are a couple of products that are in development that are close to going to market that are non-iodine teat sanitizers. The dairy industry knows about this being a problem. It's not a secret, and they're trying to find other effective solutions. And iodine, as much as too much of it can be a problem for those with thyroid disease, it's a good antiseptic. It does kill bacteria. It's very effective that way. And both the way that it kills bacteria and the way that it disrupts the immune system are based upon its production of free radicals. Anyone ever put like peroxide on their skin and see it bubble up and kind of turn white, like peroxide or bleach? So iodine does that too. It generates free radicals. And that's why it can kill bacteria, but that's also why it can hurt the immune system and cause it to attack the thyroid. So there are some non-iodized teat sanitizers that are quite a ways down the production process and the research process. And they're also trying to make ones that are more cost effective than iodine. And it's been said that in the coming year or so, they probably will replace iodine for teat sanitizing. And that could drop the iodine content in dairy foods by half or 3/4. So yes, great question. Something like that is in the works. Now, in terms of eggs or commercial bread, nothing I'm aware of. So thankfully, bread is so easy to make at home, and homemade bread is not a problem. This is not an issue of flour. Now, there's a lot of folks that avoid gluten and avoid grain products. That's fine. But for those who don't for other reasons, the problem with thyroid function is mainly the iodine in commercial baked goods. So you can work around that. With eggs, egg whites are a good substitute. And for those who move through the reset and improve their thyroid, then on that maintenance stage, they can safely include egg yolks on a rather regular basis. So they can be included during the maintenance stage. So yeah, really good question. Okay, so we're firing away really good on Instagram, on YouTube, on Facebook Live. So yeah, lots of really good questions coming in. Now, Bob had a great question about the book title, and I want to see if I can help with this question that he's got. Can I feel better taking levo? My TSH is 2.55. Doc says that's within the sweet spot and is as good as it gets. But many argue that they feel better when TSH is closer to 1. Yeah, Bob, but this is a great question, and there's a lot of elements to this. And if you're here, I would love to even hear some more detailed comments from you. The first thing is, was the medicine needed in the first place? And this is the conundrum. So it's true that if someone needs medicine, that they may do better with their TSH closer to 1 rather than in the high 2s or the mid 2s. But many people who are prescribed thyroid medicine didn't have a diagnosis that implied that they needed the medicine. And in those cases, it's not even a matter of like getting the right medicine or getting the right dose. It's just that medicine probably won't help. And this is weird because there are situations in which abnormal thyroid levels can cause symptoms, yet medications don't improve those symptoms. So, Bubba, if you know the diagnosis you were given, or if you know your blood levels at the time of diagnosis, so before you were on medication, feel free to share more data. Happy to give more feedback on that. But when someone, you talked about, I think you mentioned, I'm going back, feel better. If there are specific ways, I would infer fatigue or things like that. But if there are more specific symptoms you want to mention, I'm happy to talk about other thoughts about those symptoms, because it can be a matter of the amount of medicine, the type of medicine, or maybe it's not medicine at all. It can be still, iodine can be a factor even apart from the medication. And then also it can be a factor of these comorbidities. There's other really common conditions that coexist with abnormal thyroid function, and they themselves can either worsen or cause the symptoms completely, and they're really commonly underdiagnosed. So, Bubba, if you're there and you wish to share information about when you were diagnosed, what you were told you had, what your levels were, and or about any more symptoms that persist, happy to weigh in further on that. Let's see. Here's a great one from Healing Bravely. 37, just was diagnosed with Hashimoto's last week, just finished reading your book and about to start the reset. So ready to feel better. Yeah, welcome. You're at the right place and glad you got through the book. And I'm glad that you read through it because you realized how much potential is possible. I don't know if you're yet on medication or if there's particular symptoms. Happy to give further input if that's useful, but you've got really good odds of improving. And here's what really good odds mean. You know, I'm not someone to say things without them being well backed, and I'm not one to make bold claims unless they're pretty solid. So multiple human clinical trials have shown that people with Hashimoto's, that about 95 to 97% can radically improve their thyroid function. And about 78% can fully reverse thyroid disease just by that alone, just by doing this dietary change alone. So that's great. That's like really awesome. That's great odds. So yeah, I hope I'm excited for you and optimistic for you and love to hear your feedback and see how things go for you. I had some other great questions. I'm seeing some more coming in. Quick one for Joanne. Further updates on WP. No details just yet, but again, hopeful for, I don't know. I hate to put a hard time frame on this because you never know for certain, but I was left with the impression that we're probably looking at sometime in the coming year, maybe early, maybe mid, tough to say, but it just sounded very optimistic about it being a real thing, but it really coming back. Okay. So great. Bubba, diagnosis, hypothyroidism, antibodies negative, TSH 8.3 time of diagnosis, free T4 1.2, free T3, symptoms fatigue, medication T4 only. Okay, so Bubba, this is great. So you were diagnosed with hypothyroidism. Per your blood levels, we can talk a little more details. Now, you were actually at a stage called subclinical hypothyroidism. The difference there between, and we talk about overt and subclinical. And they're both hypothyroidism. So the doctor may not have been wrong, but overt hypothyroidism is where the TSH is over 20 and or your free T4 has dropped well below range. Now, the difference is that overt hypothyroidism, often we see symptomatic improvement with medication. With subclinical hypothyroidism, the data is really strong that we don't consistently see improvement with medication. So, yeah, I'm going to share an article that I wrote about this, Bubba. And if it makes sense, perhaps your doctor may wish to read this, but I'm getting the link up here. This has been like a big bombshell in the world of thyroid treatment is that we now know that, yeah, meds more often than not don't help with subclinical disease. Let me see if I can get this link to show up properly. Okay. I'm going to get this one up after the fact because I'm finding it, but the link is being weird for me. So I'll post this afterwards. I'm going to put this on my list of to-dos. Post link, ch. Okay. I will get that up after the fact, my friend. But yeah, if you can also Google my name and you'll see that show up. So fatigue, the main symptoms. So what to do to feel better. I'll also put up a link about an article I wrote about 14 most common causes of fatigue with thyroid disease and how they're commonly missed. I'll get that one up too. Okay. We have 14 common causes of fatigue with hypothyroidism. And they're there as well, and they're really common. They're often underdiagnosed and undertreated. In the meantime, the thyroid reset diet can be of benefit regardless of these scenarios. It cuts the odds of subclinical disease worsening and helps your body respond better to any treatment you do, including medication. So yeah, the thyroid reset diet is a great starting place regardless of whatever else we see. Follow-up comments, healing bravely we just talked about, no medications yet. Asked my doctor for 3 months to try to change my diet. Perfect. It makes it a lot easier. So yeah, that's great, great news. I'm gonna get another previously sent in question here up. There's a lot of really good ones. Yeah, one that came in, let me scroll through these real quick. I mentioned the red light therapy, the food when we talked about that. One that I want to talk about quickly is about hair loss. I had a question about what is the most common cause of hair loss with thyroid disease. So we briefly want to differentiate a few terms. There's effluvium, which is just excessive hair loss. There's more coming out on a daily basis than one would expect. And then alopecia, that's where there's a visible gaps, where there's visible missing hair. So yeah, effluvium is more hair coming out. Alopecia is there's less hair present. And now we've got anagen and telogen, and these are phases of hair activity. So the follicles grow over a 2 to 6 year cycle, and they're active and dormant over a 2 to 4 month cycle. The relevance of these terms is that something that causes hair loss may take some time to really reverse. The shedding stops the quickest, but the growth can take months or years, even when the problems are solved. Now, the most common problem by far is a lack of iron, is the body being low in iron. That's not the only cause by any means, but it's the most common single cause in hair loss with women with thyroid disease. What happens is that iron is lost. It's being lost through activity, through menstrual blood loss. And with thyroid disease, the requirements for iron can be higher, the absorption can be lower, and the loss can be greater. So in terms of helping with that, there's a newer blend called Easy Iron, and so many people that don't tolerate iron pills or they don't work, this does work for them, which is super exciting. Many with thyroid disease have another autoimmune disease that makes them unable to absorb iron properly in their stomach. But we've seen many that have this atrophic gastritis. They often can raise iron for the first time with this oral form. Ferrous fumarate is a big part of it. That's a version of iron that's in mushrooms. It's quite concentrated and well absorbed. But then piperine, which is a pepper extract, that helps the iron get into the bloodstream more effectively. And some papers have shown that it allows 20 times more to come in than would otherwise. And then also we think about the effects of vitamin C and citric acid. These two lower the side effects. they make iron better tolerated. But yeah, if iron's been low, easy iron can often reverse that. And that's by far the biggest single cause for hair loss. Okay. Let's see. So here's a great question. Oh, Shelly's with us. Hey, Shelly, welcome. Uh, yeah, Shelly, do you do consultations? 33-year-old male athlete, severe CFS, hypo, TSH, yeah, reverse 2, 3 other details. Yeah, I do. And a couple of options. Let me just share another image with you guys. So the two options for working with me or my team are either as a consultant or as a prescriber. And as a consultant, let me just put this up here. There it is. As a consultant, I work with people anywhere. So wherever someone lives, whatever state, whatever internationally, whatever country, it doesn't matter. I can be a consultant and I can talk through one situation, make sense out of the labs, help guide future steps, and do those things. So these are on availability basis. I did open some up actually for the earliest part of December. I just open these up every now and then. So there's just a few slots at a time that come available just because my schedule is often tight. So just at thyroidopinion.com, you can go there and learn more. If it makes sense, you can book a second thyroid opinion. From there, you can upload your data. We can set it up. I'll go through everything in good detail and we'll talk in person and you'll get a plan. Now, the other option is I've got an excellent team at integrativehealthcare.com. And these doctors work with people in as prescribers. And we work with those who are in Arizona, California, also Utah, Montana, Washington, and Oregon. I had the list written down to be sure that I wouldn't get the states wrong. But yeah, in those states, we can work virtually and act as prescribers and manage medication, help people get on the right amounts or less or none, and manage all facets of their care directly. So I just dropped that link in the chats for the clinic. But yep, happy to help out in person as a consultant or as my team. So yeah. All right. Lots of really good questions coming in, you guys. So now I'm at the state where I'm wanting to cover all of them. So here's one. Can I do a Zoom visit with your staff if I'm visiting family in Arizona? Yes, that is an option as well. CG Princess. Totally happy to help that way. Lots of good questions. Trying to pick through these and cover a few more of them. So let's see. Yeah, Carol Willis also talking about hair loss. Yeah, really common symptom, Carol. And you're right. There's been quite a bit of that. It can happen after illness. What happens is that when someone is sick, the cycle of hair follicle activity and dormancy resets. So any acute cause of inflammation, like a viral illness, can cause more shedding to occur, as can pregnancy. And one paper I saw showed that at any given point in time, women in their 30s, 40s, and 50s, upwards of 30% are aware of hair loss. So very common thing, very big problem overall. And it's, of course, a concern in terms of just one's personal appearance, but also it's a sign of there being things not working right in the body. It means connective tissues are not growing properly. And yeah, in so many cases, low iron is the culprit. And the problem is that it's just hard to assimilate it well. I'm going to drop the link up about the easy iron. For most people, this is just one a day with meals, which is really simple and typically much better tolerated. You know, iron supplements, there's kind of like two categories. So one category, they put tiny, tiny, tiny amounts of iron, and they call them natural iron, gentle iron, plant-based iron, things like that. And they tend not to cause any gastrointestinal side effects. But they don't help. They're just not enough to help. The other category of iron pills, they've got a whopping dose of elemental iron, but they're not tolerated. So they could work, but no one can take them because of just stomach side effects. So that's why this one is different. You've got enough to work, but you've got things to lower the side effects and make it better tolerated. Okay, more good questions coming in. Let me grab a couple here too. I want to mention this one quickly. Can you have hyperparathyroid without high calcium? Now, this came in on Instagram, and parathyroid disease is a really big deal. And I'm tempted to say it's common, but common is an ill-defined term. So of those with thyroid disease, it may affect 3 to 7%. So how's that? That's a better defined term. Non-thyroid patients, it's probably somewhere less than 1%. But of those with thyroid disease, 3 to 7%. So not really all that rare. Now, the parathyroid glands, there's usually 4, and they're usually on the sides of the thyroid. And I say usually. There can be fewer, there can be more, they can be elsewhere, but that's typically how they present. What they do is they govern the intake of calcium from the bones of the gut into the bloodstream. So PTH, parathyroid hormone, pulls calcium into the blood. And the amount you need in the blood is crazy exacting. If there's a hint too much or too little, a big long range of chemical reactions cannot work right in your body, including like your heartbeat, like really important stuff. But it also affects nerve conduction. It affects metabolism rate. It affects detoxification pathways, pretty much any symptom you can think of. The big ones, though, include fatigue, depression, anxiety, IBS, bone pain, arthralgia, urinary symptoms, stool irregularities. These are some of the main core ones, and they're common. I've seen so many times where people have clear abnormal calcium levels and their doctors tell them they're fine. If your calcium's abnormal, it's never fine. There's always got to be a reason for that. And they're always important reasons. Now, the question was, let me scroll back. Can you have hyperparathyroid without high calcium? The short answer is yes, you can. Here's how. So there should be a seesaw relationship between calcium levels and parathyroid hormones. So when things work right, as calcium gets high normal, parathyroid hormones should go low so your body doesn't go higher in calcium. So when that doesn't work right, it will be higher even if calcium is high normal. So you can have high normal calcium, and if you don't have low levels of parathyroid hormone, that's suggestive of there being a parathyroid problem. So what are high levels of calcium? There's pretty broad consensus that calcium levels, including or above 9.8, can correlate with parathyroid disease, even if they're normal. So if calcium's above 9.8 or at 9.8, it's worth looking at parathyroid levels. And if parathyroid levels are not low, this can be a hidden reason behind a lot of problems. So I'm seeing a lot of practitioners come on. I often see doctors and others that have medical titles and medical things in their name. And welcome, welcome. This is Office Hours Live. And I'm happy to also cover key cases that come up. So if there are questions you see, I'm happy to help address those. The other thing for practitioners to know is that we have a series of webinars going on at thyroid-specific formulations. And the coming one will be on September 8th, and this will be about hyperparathyroidism, about diagnosing and managing, hyperthyroidism. I was just talking about parathyroid disease. No, this is about hyperthyroidism, not para. And we'll talk in great detail about the main causes of that, how you can address that naturally, and how you can help your patients and clients. I'm going to drop a link. So if you're a practitioner, just visit thyroidspecificformulations.com. There's a spot where it says, I am a provider. Just start that process of applying for a wholesale account. You don't have to buy anything. You will be given access to that free webinar and many others that have gone on before it. So if you're a practitioner, come on over, and there's a lot of practitioner-specific training available there for you. Okay, lots of good questions. Here's one from our YouTube friends. Can injury and wound healing affect thyroid function? Interestingly, they can. A lot of things that create greater demands upon metabolic rate can change thyroid output. As a generalization, they tend to lower the output of thyroid hormones and decrease the activation of thyroid hormones. So they can cause lower proportionate amounts of T3, higher proportionate amounts of reverse T3, and also times changes in T4. Sometimes they can also cause TSH to run a bit higher. Now, that's true of injuries and wound healing. That can also be true of weight loss, calorie restriction, and or low carbohydrate diets. Those are all things that work in the same way to suppress basal metabolic rate. The basic idea is your body is trying to slow down and give itself a better chance to heal. So it tries to suppress metabolism. So yes, many factors can affect that. And a great consideration is that, I don't know, anything that looks really weird on a blood test, it's smart to just give things some time and recheck and see if it persists. It's so common that some temporary reason may be affecting the thyroid, but it may not be an ongoing or lasting problem. So very smart to just give things a pause and see if this is a trend or just a glitch, because both can happen. All right. So I'm just scrolling through and trying to pick and choose. There's a lot of good questions here, you guys. Um, Related ones too are also relevant. So how do we test parathyroid levels? Well, and this is tricky because I'm talking about a lot of crazy detail with parathyroid disease. Of course, this is stuff that you'd be sorting through with a practitioner to make sense out of. There's a simple blood marker of parathyroid hormone. And in the context of serum calcium, it's quite revealing. So it can be altered. It can also be altered by vitamin D status and or hyperthyroidism. I think someone even asked about that. So when someone is hyperthyroid, either because they have untreated Graves' disease or if they're on a high dose of medication, that can cause serum calcium levels to go high. And what's happening there is the bones are breaking down. So yeah, the bones are breaking down and spilling calcium into the bloodstream. It's pretty common in those cases that parathyroid hormones are going to be low normal or actually low because the body is trying not to put more calcium into the blood. And not intuitive, but in that situation, it's very important to be consuming adequate calcium because the bones are breaking down. Now, when there's hyperparathyroid disease, on the other hand, it's better to be watching and modulating calcium. But yeah, it's quite common that that can elevate from just too much thyroid hormone. Beautiful explanation of the normal seesaw relationship between serum calcium and PTH. Thank you for that. Glad that was helpful. Let's grab at least one more here. Boy, here's a good one. Those things that can cause fatigue and Hashis, are they or can they be the same for other autoimmune diseases? They can. And Christine, here's a great thought. So autoimmunity by itself can be a big cause of fatigue. I'm going to pull this article up and share it with you guys if I can get this to work properly. Okay. Yeah, so just having the autoimmune antibodies, the autoimmune process, that alone can be a driver of fatigue. And even if there are normal thyroid levels. So here's the 14 hidden causes of fatigue and solutions. I was able to pull up this video. That's up there now, and those are on YouTube. That's an easy thing to get to, but that's just right there on YouTube. But that's a big one. Now, one that people often don't think about is body weight. So just a few extra pounds in or around the organs, they can cause fatigue. Overt obesity can as well, but sometimes just those few pounds in the wrong places, they can do it. They can slow down that reaction by which the liver generates energy pretty badly. So those are a couple of big ones. We think too a lot about the relationship between sleep quality and sleep depth and oxygenation during sleep and fatigue. We also think about the status of many nutrients. We talked about iron a bit earlier. That's a common one that many are low in, and they can be low in even if they're said to be normal per their blood levels. So that's a big driver as well. Of course, one's adrenal function can be a big factor. If there's not that healthy morning spike, nighttime drop of cortisol, we see a great deal of reduction in energy levels. So, yeah. And interestingly enough, too, a little too much thyroid medication can cause fatigue. That's not intuitive. People think that if they're tired from too little, that more would always be better. But too much can cause fatigue just as badly as too little can. That's quite common. So, comment. Frankie shared this. Thank you for sharing that, Frankie. Note to Bubba, long-term use of thyroid reset diet has helped me begin to deprescribe when I should have never been put on medication 22 years ago. Yeah, great question is who can come off of medication? And there's some things that make it more likely, but there's very few things that make it impossible. So not having a thyroid, well, that almost always makes it impossible. There are some people that don't think they have a thyroid, but they've actually got a fair amount of thyroid left. So I've seen that happen. Now, that's not common by any means, but generally, not having a thyroid means you need medication long term. Also, if one's dose of medication is the full amount your body would ever make, if you're at the full requirement, that means you're making less. And that means the odds are lower, but they're still not zero. So there have been many studies. And Bubba, I was talking with you about this. The clear thing from data is that most people on medication never needed them. So the follow-up question that was put to researchers, was if that's true, can people come off of their medication? And there have been many big studies done on this, and it's been called deprescribing. And it turns out that even those with overt hypothyroidism, many can successfully deprescribe. So if we include those with all levels of hypo and Hashis, the odds are that about 85% can do well on less medication with no negative changes in symptoms or blood levels. And of them, somewhere around half can eventually require no medication and be totally fine. So, and these are from studies that didn't do a lot of very elaborate stuff. They really just had people lower their dose and hope they were okay. If you look at the guidelines in the thyroid reset diet, the odds are only going to get better for you. But we know from large studies that at least somewhere around 40 to 50% can do fine on none, and about 85% or so can do better on less. And it's more than a matter of just, I don't know, having independence and having your body work again. That's cool. That's big. But it's even more than that. The data's gotten clear that making your own thyroid hormone is not the same as taking thyroid hormone. The more you can make, the better your long-term health can be. So it's an important thing, and it's really worth pursuing. Okay. So follow-up question from Fleur, is the fatigue from too much medication due to the iodine? Great question, Fleur, and it's hard to pull that apart. So when there's too much medication, one thing that happens is that the body is then getting rid of it faster. And that does involve a lot of enzymes that manage iodine. We know that you're getting rid of iodine and converting the T4 and T3 into less and less active forms. We also know that your cells block the uptake of thyroid hormone and that your body packages them up with proteins and that you eliminate them faster. So a lot of mechanisms kick in that make you fight thyroid hormones. Now, there's a point at where those things can't fight anymore and there's just too much. There's no two ways about it. But short of that, it's really common that people who are taking too much, they feel just like they're taking too little because their bodies are resisting it. Their bodies are making themselves numb and intentionally blocking the effect of the thyroid hormones. Okay, let me get one more here. And I think this one came up in a couple of ways. How Graves affects liver enzymes? Yeah, great question. Graves' disease can raise liver enzymes, and quite simply, it speeds up one set of liver reactions without speeding up others. And also, the liver is involved with detoxifying and clearing the extra thyroid hormones. So yeah, it's very common that Graves and hyperthyroidism in general. I want to differentiate those two. So Graves is an autoimmune disease that makes the thyroid overproduce. But someone who's on a high dose of thyroid medication can have a lot of those same things happen. So both can have harm occur to their liver. So here's a related question. My parathyroid number is 98. Any recommendations? Yeah, Linda, great question. So in most cases, that represents hyperparathyroidism, not all. There are other times in which that's an adaptation to other problems. If it is hyperparathyroidism, the treatment for that is surgery. And the surgery is one to where there's very few surgeons that do it. But for those that do it, it's a very straightforward process. It can be in and out 20 minutes, no general anesthesia sometimes, and very little risk of complications. So it depends greatly upon who is doing the surgery. There's a group in the US called the Norman Parathyroid Center. They've got a few surgeons that have branched off and have left from them, but are still involved and affiliated. I've interviewed some on my podcast, but they're great. But you really want someone specialized for that. So yeah, if it clearly is that, that's what is needed. Linda, those who do second opinion consults, those are situations which I can help clarify questions just like that. So if you did want to know, of course, your team, if they couldn't sort that out well, that could be a valid purpose for a second opinion consult. And those are at thyroidopinion.com. I will put that up, opinion.com. Yeah, I'm happy to look through those things and make sense out of that. All right, it's Office Hours Live. And let me take a peek at the schedule here. So next week, I will be in Austin. This will be the How Do You Health event. And then traveling afterward. Yep. So no office hours next week, back on schedule for the 12th, the week afterward. But the How Do You Health event will be a really good one. I'll make sure we get links up for that too. Anyone in the Texas area that hasn't yet signed up. We're seeing folks come from all over the world to attend that, but it's probably last minute for those out of the area. But yeah, Austin, Texas, this will be this coming week, Friday, Saturday, Sunday. Really great health fair. Pretty different thing, very experiential, small groups, interactive, good information. So I'm really excited to speak at that and be a part of it. But look forward to seeing you guys on the 12th for office hours again. In the meantime, though, keep the good questions coming and take great care of yourselves. Bye-bye.